This is presentation 2 for the dose response models group, including Dustin Duffy, Gerard Garvin, Vanessa Kennelly, and Daniel Stone. Hello, my name is Daniel Stone, and to kickstart the presentation for the dose response models group, we're going to do a quick Q&A with the questions from the first presentation. The first question is, do you think that MCP mod is the best hybrid approach for the migraine study, or do you think there is a better one? And we looked into some of the other approaches that have been proposed, and these are also hybrid approaches. Here's the documentation for them, and we would encourage you guys to do further research if you're interested. We also want to comment that we do believe that this approach is a good approach for several reasons. First of all, though other approaches do exist in the literature, our project is focused on this particular methodology, and also the FDA gave the MCP mod its fit for purpose designation for guiding dose selection for phase 3 testing. Only one other tool had previously received this designation, and so we feel confident that it is a good tool. Additionally, the following is a quote from the European Medicines Agency, and it has to do with the CHMP qualification, and it's concluded that the MCP mod approach can be qualified as an efficient statistical methodology for model-based design and analysis of phase 2 dose-finding studies under model uncertainty. And so I'll let you read through the rest, but we would conclude indeed that this is a good process, and we feel confident that it will give good results. Almost as an aside, I do want to mention that some other additions or changes to the MCP mod have been proposed since it has come out. Some that make it a little more adaptive or reduce the number of assumptions that are made at the forefront. And so, those might be looking into as well. But based on the findings from the FDA and the EMA of the MCP mod process, we believe that it's effective and beneficial and can be utilized for dose finding analysis. The next question addresses potential drawbacks of using this method and comparing so many models. So there are several potential drawbacks for the MCP mod process. There's no process that's perfect, so one of these drawbacks is that there could be an increase in false discovery rate. If you specify enough models, you're bound to find one that fits by chance. So there's always that possibility. Another drawback comes from the FDA review of the method, and their finding was that the MCP mod method does seem to be sensitive to the initial guesses of the model shapes. And so, this is a drawback when you are comparing so many models. The initial guesses will be so influential in the final analysis, could be a potential drawback. A further potential drawback is based off the fact that the MCP mod approach begins with a set of potential dose response models and tests for a significant dose response effect using multiple linear contrasts, and tests and selects the best model among those with a significant contrast test. So and we'll get into this later in the presentation when we review the full approach. But a possible disadvantage of this is that the parameter values of the candidate models need to be fixed a priori for the contrast tests. A final drawback just has to do with the questions: how do we identify the best matching model from the set of candidate models most appropriately? Is it preferable to select the model based on information criteria or to use model averaging techniques? These are questions we hope to answer in our third presentation, though they might go beyond the scope of this project. Things that we can do in our analysis will help us with this, but that is another potential drawback here. The following question, though it's a great question. I don't have an adequate answer for it this time. The question is, are there any examples of successful drugs that have made it to market via using the MCP mod hybrid approach? And the answer to that question, I'm not 100% certain. I did do some, look a little bit, but at the time of this presentation, I don't have a solid answer for that. I did, however, see a lot of evidence that this process is prolific. It's been around for a while. The following is a list of references from applied literature of studies that have used the the MCP mod approach in their studies. And there's a second page. I'm just putting this up here to give you guys a sense of the scope of it. Whether these have totally come to fruition yet, I don't know for all of these. And so the process is being used. I wanted to give you guys another list here. Again, this is just to give you a sense of the fact that it's being used, but these are specifically done by Novartis, which, is the organization that did promote the MCP mod process. And so, these are all studies that are being done by Novartis specifically. But in each case, this MCP mod process is either the main or the primary analysis method, or in some cases, though few, secondary or exploratory analysis. And so, again, I've got another slide here too, but these are, list some of these studies being done just specifically by Novartis. So if you look, just even a quick Google search will show you that there are a number of, a good amount of studies that are using this process. It's out there, and so there's a lot of it being used. This next question, unfortunately, is another one that I don't have a direct answer for. The question is, can you give some background information regarding the statistical procedures employed in the clinical trials of a migraine headache medication that's currently on the market named sumatriptan or Imitrex? Unfortunately, I'm not familiar with that medication and it was not involved in our study, but the following is an abstract from a paper published through PubMed, and you can find it. I listed the reference there. But the main reason I'm posting this response is because it shows again that, this medication is being used a lot. And so, and there's a lot of different studies that have been done on this medication. So this is an old abstract, but even at the time of this writing, sumatriptan had been used to treat more than 236 million migraine attacks worldwide. In clinical trials alone, more than 88,000 migraine patients had treated more than 300,000 migraine attacks with this medication. And so you can see, there's a lot of studies being done, and, I couldn't possibly comment on all of the different statistical procedures that are being employed with it. And so I just wanted to mention that, but still also, attempt to address the question. This is another great question that we received, and it had to do with the study MK3207, which specifically had to do with migraines, and it was the study that was used to demonstrate the process, the MCP mod process. And the question is how the pain response was addressed in patients. Was there a subjective rating, and so forth. And so here's the response. Now, patients who met all the study criteria, obviously, who are being involved in the study, they were taken on an outpatient basis. As soon as they experienced a moderate or severe migraine headache, they were given the medication. Okay, patients were instructed not to treat with a rescue medication, and so in terms of this trial, a rescue medication is a medication that they've already used that has been demonstrated to work. So they have kind of a rescue medication, a go-to, and yet they've been asked not to use that rescue medication until their 2-hour pain assessment and after that. And so, what they do is during that 48 hours following the initial dose of the study medication, the subjects do record their assessment of pain severity and its associated migraine symptoms, and they record it in a diary that they were given. They also record information about adverse events. Patients return to the study site to give further feedback. So here is how that subjective information was given back in terms of the medication. Headache severity was assessed using a 4-grade scale of no pain, mild pain, moderate pain, or severe pain at baseline, which was considered 0-hour time of taking the study medication, and then again at 30 minutes, an hour and 30 minutes, 2 hours, 2 hours and 30 minutes, 24 and 48 hours post-dose. And they were also looking for the presence of some of the symptoms that we went over in the first presentation that include phonophobia, photophobia, which is all based on sound and sight, and then nausea, vomiting, and ratings of functional disability, and which was also on a 4-grade scale: normal, mildly impaired, severely impaired, and requires bed rest. And so all these are also recorded at the same time points as the headache severity. And so you get an idea here based on the what you see, this 4-point scale, what kind of stuff was recorded, what researchers were looking for. The final question that I'm going to address in this portion of the presentation has to do with the program that we've chosen for our analysis, and we have chosen to use R for our analysis. Our project is in R, our data set's in R, and so it just made sense for us, though we have no reason to believe that SAS would not also be a valid approach.
In addition to the Q&A, we also just wanted to do a brief overview of the R package and methods that we're going to be using to do the statistical analysis. Now, we're not going to get into it, but just to give you guys a sense of what we're doing and how it's going to come together and how it's going to work. Again, just briefly, so that you guys have a picture of what the analysis will hopefully look like.
So the package, that if you guys wanted to try to replicate what we're doing or just look at it and play with it a little bit, is called Dose Finding, and again, it's in R. You see some of the specs here, and it's a package. It provides functions for the design and analysis of dose finding experiments, with focus on the pharmaceutical phase too. Okay, and so of clinical trials. And so there's a lot of different functions in there. I'm going to try to provide just a brief overview, but some of the functions include multiple contrast tests, fitting nonlinear dose response models, and calculating optimal designs. We're not going to use all of these functions, but again, just to give you a sense of what we're using. And then the data set, again, if you wanted to try to replicate this or do some research into it, is just called migraine. And so once you've uploaded the package for the MCP mod, you could pull up the migraine data set and take a look at it. Again, it's based off of the trial here, which you can find on clinicaltrials.gov, which has been cited or will be cited in later in the presentation. And this is a randomized placebo-controlled dose response trial for treatment of acute migraine. The primary endpoint was pain freedom at 2 hours post-dose, and it's a binary measurement. And so that, again, that's how you would pull it up. If you do look at the data set, it's worth just mentioning kind of how it's organized, but it's just a data frame with 517 columns corresponding to the patients that completed the trial. And there's these three columns: dose, which is a numeric vector containing the dose values. There's pain-free, which is the number of treatment responders, and then NTRT, which is the number of subjects per treatment group. Now, the process itself, MCP mod, this tests for dose response effect using a model-based multiple contrast test. I'm also going to highlight the MCT test and the FIT mod that are shown there, but it does select one or several models from the significant shapes and fits them. And so, that's kind of the beginning or that first stage of the MCP mod process. I wanted to highlight a couple other functions here. The MCT test, this performs the multiple contrast test. So this function performs this these multiple contrast test, and the contrasts are either directly specified or there's optimal contrasts that are derived from these other arguments. And so those of you who are familiar with our, you would be more familiar with this, or you might consider looking into this a little more. Mods, this function, it allows to define a set of the dose response models, and the function is used as an input object for the other different functions. And so this is what R is using when it's for this function. Here, the function fitmod, it fits nonlinear dose response model, and it's a built-in, there are built-in dose response models, and they are they're listed here. I think we've done this elsewhere, and I'm actually going to show you a list on the following slides here. But you can see there's well, here, let me show you guys a list of the different models. So you can see the Emax model, Sigmoid, Emax, exponential, and I don't want to read all these to you, but I wanted you guys to see what R is using for these, for the beta, linear, linear in, logistic, and quadratic models, so that you have that at least as a reference. And with that, we will move on to the next part of our presentation.